Hi, my name is Chantelle Mundy. I work at the Ohio State University Wexner Medical Center in the Advanced Specialty Contact Lens Department. I am part of the team that takes care of specialty contact lens patients, and I'm also the residency coordinator. So I work with residents, contact lens residents, and also teach students and ophthalmology residents. Fittings, PROSE, and specialty lenses have changed my perspective on patients' needs because they're so unique. So using the personalized approach and finding out exactly what the patients need, I think exploring all of those and so we can give personalized care is where I think it's changed my perspective. So their occupation, their day-to-day activities, and then how can we contribute to that improves their quality of life. There's two major reasons why I like working with BostonSight and PROSE. And number one is the design and the technology that I have access to for my patients. That really helps me manage a higher disease patient population. And number two is the organization. The support of the consultants and the doctors help me make those decisions and make those design changes that I need to take care of the patient population. I decide to use PROSE versus a traditional scleral lens depending on sometimes complexity and disease condition. So I really make that choice based on the patient. One example that I would use for a patient population that I would go to PROSE versus a traditional scleral lens would be something similar to graft versus host disease, where there's underlying systemic disease, and that gives me more capabilities to make changes and for a longer period of time. Our corneal specialists at Wexner Medical Center are very knowledgeable about PROSE and scleral lenses. And if they need an initial consult, a lot of times they'll send those patients before considering surgeries, let's say for a corneal scar or advanced keratoconus patient or any keratoconus patient really that's not attempted or tried scleral lenses or PROSE. They'll want to make sure that they can try that treatment before moving on to anything else. I think one important thing about our clinic is that we have such support both administratively and from our ophthalmologist. We have in-house 4 corneal specialists. In addition to that, we have glaucoma and retina, neuro, oculoplastics, and we're all together on the same floor. So it really does help us kind of a team approach into patient management, when especially patients with multiple disease processes. We can all work together. My patient experience with specialty lenses depends a lot on my staff and my team, so I really value their support in how we provide that service, because especially newer wearers, patients who've never worn contact lenses before, they need some support as they're learning how to apply and remove the lens. So our hope is that we can guide them as best we can in the beginning so they feel comfortable with that, because we know we're asking them to incorporate this into their daily life. So we want to make sure that we give them as much knowledge and support as we start that process as we can. A patient experience that really impacted me and tends to impact me when I see this happen is especially with a younger person, particularly a patient with keratoconus that has very debilitating vision, and you're able to improve their vision such that they can drive and they can go to school and they can work. And so you can see how it's impacted the trajectory of their life by being able to see. I think what I look forward to accomplishing as I continue to use PROSE is just being able to manage more complex disease and be able to use the device and use BostonSight to help me do that. I think there's a couple things that I would list as my favorites, but number one is the patients. Seeing the change as we help and manage something when a patient comes to us that they've never been able to see before, they've never had a lens that's worked before, and we're able to see that change, sometimes even in the exam room, as we put on the first lens, and they're all of a sudden, one, able to see, or number two, patients with chronic dry eye disease or ocular surface disease can open their eyes, or they are able to feel comfortable for the first time in years. That is such amazing experience as a doctor to be able to contribute to someone's quality of life and impact them that way. And also teaching, having a contact lens resident with me, having students, ophthalmology and optometry students, and then watching those people go forward with their careers, that's one of the other aspects of my job that I really enjoy.